Well, for those of you who, and this would include most senators and representatives in the United States Congress who haven't read the president's health care bill, here's, because people say, I haven't read that. I'm not familiar with that. Well, we had somebody go through it, and line by line. Now, remember, the thing is 1,000 pages, over 1,000 pages long, but here's some of the nuggets in there. On page 22 of the bill, it mandates that the government will audit the books of all employees that don't buy the government health insurance plan, that buy their own.
Just come in there and stick their beak in your business.
That's right. Page 30 of Section 123, there will be a government committee that decides what treatments are beneficial and who gets them. In other words, page 29 of the bill, lines 4 through 16 talk about how the health care will be rationed. By the way, old folks under this bill, this is basically nothing more than a dismantling of Medicare. It throws all that away. And then in Medicare, old people got the highest level of medical attention in our society. In the new Barack Obama world, old people will get the least attention. Well, let's face it, because they're old. Not much we can do for them.
Yeah.
But they will be given, there's a line in here that says they will be given end-of-life counseling when they are decided that there's not anything we can do for them.
That sounds pleasant.
Yeah.
You're too old to qualify for any good health care anymore, but we'll have a guy come by and talk to you about how things are going to go as you die.
That's right. Page 42 of the bill, Health Choices Commissioner appointed by the president will choose which benefits are for you based on your health profile. Page 50, Section 152 of the bill will be provided to all non-U.S. citizens, legal, illegal, or otherwise. So that's in there. Mm-hmm. Page 58, the government will have real-time access to individuals' finances and complete profile. A national ID health card will be issued, which will have attached to it every piece of personal information about you and your background will be encoded on that card.
It's good to know the president's looking out for you.
Page 59, lines 21 through 24, the government will have direct access to your bank accounts.
What?
For election fund transfer, so that in case you like the way the health care thing is going and you want to donate money to a presidential campaign, you can do it right through your health care card.
Wow.
Isn't that great?
They are thinking of everything to make your life more convenient.
We're only up to page 59 of 1,000 plus.
And it's just the highlights of each page.
Yeah. Page 65, there's a payoff subsidized plan for retirees and their families who happen to belong to unions or community organization groups like ACORN. They will get special treatment under this bill that you won't get unless you belong to a union. In other words, if you don't belong to a union, if you join one, you'll get more favorable treatment. Or if you belong to a community organizer group like ACORN, because they're out there doing good work, like registering Terrell Owens and Mickey Mouse to vote in Las Vegas.
That's right. We got the entire Dallas Cowboy lineup registered to vote out there in Vegas or Nevada somewhere.
Page 84 of the bill, government mandates all benefit packages for private citizens and plans an exchange program for those who want to buy private plans. Government mandates linguistic appropriation services. In other words, all clinics run by the government will have standby translators for illegal immigrants to be able to talk to the staff. Isn't this just a marvelous? This is one of the fun things. Page 95 of the bill provides large payments for the work of ACORN and going out and signing up people for the health care plan.
Yeah, ACORN is benefiting massively out of all of this.
That's how they keep popping up, and Obama used to work with them.
Still does.
Yeah, exactly. Page 127, lines 1 through 16. Doctors and the government will tell you what you can make to be able to get basically what you make for a living is also going to play into this, because later there are provisions in the bill for those who make more money to pay more money into the plan than those who don't, like illegal immigrants who make nothing. Mm-hmm. They will be, of course, taken care of. And of course, what do you think it's going to cost to have translators all over America standing by to talk to them. Anyway, it goes on and on and on and on and on and on and on. Stuff about how they can appropriate portions of your 401k plan to take care of your portion of the health care package if they see fit to seize those funds to help with your health care.
There's a lot of people out there don't have any money. Oh, look, you do. You squirreled some away. We'll have that. Thank you. Appreciate it. We do appreciate you going without and being disciplined enough to start a savings account. We'll take that too.
There's also a section in here where certain cancer hospitals are going to have to be put out of business. Certain cancer centers will be kept in business. And they'll take a hard look at how those cancer centers have handled minorities and other things in the past.
Oh, okay. A little report card first.
Yeah, and there's going to be a section in here all about affirmative action in a healthcare plan. The more you read it, the better it sounds. It just sounds like a great plan. You need to be asking all your representatives, Democrats, especially Democrats, ask them about these certain sections. Maybe we'll post this email at waltonandjohnson.com where you can use these as questioning guidelines. Ask your representative. Have you read page 241, line 6?
Did you know that was in there, and are you okay with that?
Yeah. Are you okay with page 317, blah, 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 blah? Oh, prohibition on ownership or investment. The government telling doctors they're not going to be allowed to have interest or ownership in health clinics. They got to get out of the healthcare clinic business. If they're a doctor, they need to just be a doctor and not be an investor or a businessman in the health business. So a doctor won't be able to own his own clinic under this bill.
And have no personal stake in success or failure.
Isn't that marvelous?